This is Pat Marsh, your host for the PM Talk Show. We would like to thank our fine underwriters for supporting our show.
North Shore Center for Wellness is a behavioral health care practice that offers a myriad of services to children and their families in the Tangible Hill Parish community and surrounding areas. Our mission is to promote the well-being of the individual and families by providing accessible, quality health care. North Shore features quarterly Let's Talk wellness training, community outreach, and education. You can find more on these and other trainings on Facebook. For your convenience, North Shore accepts Magellan Healthcare and is located at 904 West Coleman. North Shore Center for Wellness. It's our goal to enhance the quality of life for our clients. Parish's Supportive Living offers assistance in your home with everyday living tasks. We offer to the community long-term care, personal care, a community choice waiver, and many other services through the state Medicaid waiver program. Plus, we offer competitive direct service worker salary. You can contact Parishes at 985-662-5347. Medicaid, private pay, and insurance are accepted. EEOC. Parish's Supportive Living is also licensed and insured. Find them on the web at parishessupportiveliving.com. Total Healthcare Associates LLC, where your health, privacy, and life is important to us. We specialize in primary care and episodic care. Total Healthcare LLC, where your health is our priority, in the Professional Plaza in Hammond.
Hello again, and welcome to the PM Talk Show. This is Pat Marsh, your host, and we continue to bring you knowledgeable information about things that are happening around us. Today we have with us our special guest, Ms. Osa Betts Williams, who is a member of the Delta Sigma Theta Sorority Incorporated, as they say. But she's here to talk about healthcare. Delta is sponsoring a lot of workshops across the country to make people aware before the deadline for qualifying and before the fines begin to happen if you don't have health care. How are you doing this morning?
I'm doing great, thank you. How are you?
I'm doing great. We wanted to bring you on because we're nearing the deadline for applying for health care.
Yes.
And the date began November 1st, 2015, and it will end shortly, January 31st, 2016. And I understand that if you're found without proof or with health care, there will be a penalty, correct? Okay. What will happen if you don't do that penalty, and why is Delta so interested in getting that word out?
Well, first of all, Pat, I think that I need to explain to you what our organization is all about. Delta Sigma Theta Sorority Incorporated is a service organization. We are one of the members of the Divine Nine sorority and fraternities that are primarily African American organizations. Now, that's not to say that all of us are African Americans, because we do host and accept people of other ethnicities within our organization here at Delta Sigma Theta. So we are not exclusive in that manner. But one of the things that Delta does require is that people know that we are a service sorority, and that our members are required to exemplify and encourage high cultural, intellectual, and moral standards, and that our actions exemplify the public and personal behaviors that reflect the ideals and principles espoused by our sisterhood. In short, we are supposed to be of high standards and impeccable behavior and represent our sorority well. Because in our mission statement, it also talks about Delta Sigma Theta Sorority Incorporated is an organization of college-educated women committed to constructive development of its members and to public service with the primary focus on the Black community. Now, that does not say that we do not service other areas or other communities, but that is our primary focus, and that is a part of our historical focus. I would like to say that Delta Sigma Theta boasts a membership of over 300,000 members, and this is both within the United States and abroad. We have what's called the Central Region, the Eastern Region, the Far West Region, the Midwest Region, the South Atlantic Region, the Southern Region, and us, the blazing Southwest Region, which consists of Arkansas, Louisiana, New Mexico, and Texas, and we also host Jamaica, which is our only international region within the Southwest. Other chapters in other regions, the other regions that I mentioned earlier, include England, Germany, St. Croix and St. Thomas, which is in the U.S. Virgin Islands, Okinawa and Tokyo, which is in Japan, and Seoul, which is in the Republic of Korea, as well as Bermuda and the Bahamas. So when you look at our organization locally, Pat, you're not only looking at Hammond Area Alumni Chapter, you're looking at hundreds of other chapters throughout the United States and internationally.
And that's because health care is required across the United States.
Across the United States. Okay. And one of the thrusts that our national president, Ms. Paulette Walker, is talking about right now is that Delta become involved in encouraging healthcare citizens to seek out healthcare. And we have made plans to put on workshops. The unfortunate thing is, though, that when you put on these kinds of workshops, people don't always attend. So we turn to the media as a source of informing people about what healthcare.gov has to offer.
So obviously this is something new in the media that you've begun to do.
Well, it's not really new in the media, it's just new for our chapter. Other chapters throughout these other regions have gone ahead and as we're doing, they've done public service announcements and gatherings of different kinds, and we'll talk about that in a little bit. One of the important things to know is that this project began in November of 2015, and it will end January 31st of 2016 for this year. I can say that I'm pleased that our newly elected governor, John Bel Edwards, has gone ahead and accepted the federal funds to try to offset some of the costs here in Louisiana. Hopefully that's a good thing. So we just have to take a wait and see approach. As I was told by some other legislators, that with Louisiana being on the tail end of accepting this money, we will not reap the benefits that other states have gained who came on early on, and that was about 38 states. And they were not all Democratic states. Many of them, most of them, were Republican states.
Let me ask you this, will some of those benefits from the other states who took the federal dollars, will we be able to reap any of the benefits within the next 4 years outside of what's already going on?
Well, the money is set aside, as I understand it already. So whatever monies Louisiana is able to acquire from signing on is monies that are already there. So it's not like we're going to be taking anything from other states, but as it stands, when we did not get aboard when it became available originally, we've lost billions of dollars, as I understand it.
Because it went to maybe other states who would not have gotten as much.
It was divided amongst other states.
Okay, that's what I thought. Let's talk about the requirements for having health care or getting assistance with health care.
Well, I'm just going to tell you, I have to use my little cheat notes here because it's a lot of information, and you know, sometimes you can't commit all of this to memory and be able to give people accurate information. I also called the 800 number to get some clarification about people who are not able to get this particular health care
And that's
from this
listed at-
marketplace.
That's listed at healthcare.gov, right?
Healthcare.gov.
Okay.
I used two scenarios in talking to the representative that I spoke with. And one of them was a young man that I know who had been employed off and on during the year, but at the point that he decided to apply for health care, he was rejected. And it was because he was not employed. He could not show stable income. People who do not qualify for other means of insurance, such as Medicare, Medicaid, or any of those types of insurances, or private insurance for that matter, must show stable income. They must show a stable income. Now, I also asked the question, okay, if the deadline is January 31st and I get a job on January 28th, how will that affect me? And according to what the representative told me, is you will be asked to go to that employer and determine how much you will be making per week or per month, whatever the requirements are, and they will more or less prorate that amount in order for you to qualify before January 31st. If you missed the January 31st deadline, I don't know. I didn't get into whether or not it's going to be offered again later down the road. But as I understand it, for this year, this is the deadline, January 31st.
Okay, you have to be employed.
You have to be employed, and you must be paying taxes. You must be filing a tax report before the April 18th, I think they changed it to, or 16th, April 16th or 18th deadline. File your taxes prior to that date. And if you show that you do not have health insurance, you could be penalized. Now, in one area, as I was reading it, it talked about, I think $685, $75, something around that figure. According to that representative, it's going to be based on what your income is.
Would you say that this health care is mostly covering middle-class people? And we're going to get back to that because we're about to run out of time, but we're going to go for a break now and we'll be right back.
Okay.
Am I the only parent who thinks this? What did you do?
Do you have time to talk?
Parents back each other up to prevent youth, alcohol, and drug use. Talk to each other, share information, and you can make a difference.
Will you be home?
Will there be alcohol?
Thank you for telling me.
Back each other up. Together, we will prevent youth alcohol and drug use.
Have you met their parents?
Let's keep talking. Where can I learn more?
Learn more at backeachotherup.org.
Welcome back to the PM Talk Show. This is Pat Marsh, your host. We have with us today our guest, Mrs. Osa Betts Williams, who's a member of Delta Sigma Theta Sorority Incorporated. And she's here today. We all know that health care is a reality now. And she has some information that her sorority is sharing across this country, all over the United States, because the United States is required to have health care now. Welcome back, Ms. Osa, and we talked a little bit about Delta Sorority, the requirements for getting health care, what the feds are telling you and the government is telling you have to have, and now you have 5 ways to take action, and you want to talk about that a little bit.
Right, and again, as we said earlier, this is part of the undertaking of our sorority as a directive, or I should say as a request from our national headquarters. And a few of the things I'm going to mention real quick, and please feel encouraged to go to healthcare.gov and get the answers to all of the questions that you need to have. There is the 800 number on that web page that you can also call and speak with a professional representative of healthcare.gov. A few of the things I'm going to throw out at you are, did your job, family, or health status change? It's going to pay for you to shop for health care. It's easy to renew health care that you may already have. There is financial help available. There is free confidential help available by calling that number and going to healthcare.com. Free help in your community. There are people who are sponsoring some of these workshops. I might say that on Coleman Street, where the Greenfield Wellness Center is, there is a place in there within the Health and Wellness Center that a person is there answering some of these very same questions. You must talk to a trained enrollment professional, walk through your options, talk through your options. There are certain things that you need to bring in order to meet the qualifications. The question is asked, what is healthcare.gov? Why is it important to get covered? We mentioned earlier the tax penalty. Who can enroll in healthcare insurance through healthcare.gov? How can people enroll in coverage? And the last few are, when does open enrollment begin? We already told you that, November, and it ends January 31st. So that is the sign-up deadline. How many people have signed up for health care under the Affordable Care Act so far? And we can say over 9 million. How can consumers get health care if they have, how can consumers get help if they have questions? Is it true that people who do not have health care have to pay a fee? Yes, it is true, and that's under healthcare.gov. Is it fair that people are required to purchase health insurance? Are you using the fee to scare people into getting health coverage? That is answered under healthcare.gov. How is the healthcare law and healthcare.gov improving benefits and consumer protection? Again, go to healthcare.gov. I continue to mention that website because that is how you're going to get the answers to all of the questions that you have about this initiative.
Right, and there are a lot of answers to those questions, but just know that the government is very serious about the penalties, correct?
Yes, $695.
Okay, and if
And
you
to me,
file
that's
taxes
serious.
and you get taxes, how do they say they're going to get theirs off the top?
Yes.
So if you look at health issues that you may or may not have, or maybe you are at the age where health issues began, it's good to know that you have coverage.
And the most important thing to know is that there are no pre-existing clauses,
Right.
such as what you have with your employment health care and some of the other health care providers within the healthcare marketplace.
Also on healthcare.gov, they have all of the stats for Louisiana, correct?
Right, and this is what it's going to look like. I have 2 pages, and the most affected and disenfranchised, as usual, is African Americans and females.
Right.
So I urge you to go to healthcare.gov and remember, Delta Sigma Theta Sorority Incorporated sent you there.
Ladies and gentlemen, she loves that name.
I love it.
She and my daughter love that name.
Yes.
Healthcare.gov, and there was another site on here that I was looking at.
It's at the bottom right here.
Yeah, for the stats.
www.enrollinamerica.org.
Right, and this is where you find all of the stats.
Again, that's enrollamerica.org.
Yes, and healthcare.gov.
Right.
Sites that you can go to and find out, and it's only a few days away if you have not done so.
Right.
Please look at it, see if you want to do it. If you have done so, thank you for doing so. I hear a lot of people say that they thought it was going to be a difficult thing, but they're paying less now than they were through any other places.
That's correct.
To get coverage. So
and there are people who could not get coverage who are able to get coverage now under this program.
Right.
I am not saying that this is a perfect alternative for everyone, because, you know, I've heard some of the complaints, but when you look at the big picture, there are so many people who do not qualify for health care. They do not qualify for Medicaid.
Correct.
And some may not qualify for Medicare, you know. So it's a viable option. You know, it's something that's offered by the government. Many have said that they do not feel that they should be required to have health insurance. But one of the things that I think about is if you are in a critical situation with a critical illness, a terminal illness, or even an accident, and you have no health coverage, and you go to one of our regional hospitals where they cater to indigent people, you're still going to get a bill. So it's a no-win situation, really, in some situations.
Yeah. Well, I think we have time to talk about people who have worked on retirement all year.
Right.
Are they able to qualify for this type of coverage as well?
As long as they can show that they have a stable income. So if you retired and you were not able to afford the insurance that your employer had while you were on the job, and you have that stable retirement income, according to what the representative said to me, you can apply at healthcare.gov, speak with the representative, and most probably be given insurance.
So what about young people who have worked on different jobs, say during last year? I mean.
Right. Again, the scenario was the young man who had been working off and on and decided to apply when he was unemployed and was rejected. So I recommend that even if you have a short-term job before January 31st, try to go ahead and apply while you are employed. Allow them to work up the scale for you and get your health insurance while you are employed.
Okay, so better to be safe than sorry.
Always.
Okay, because the government is serious.
Very serious.
For now, and you know, unless something changed, this is what it is. And we have to do what we have to do.
It's a law, and it was passed, so it's
so
another one of those.
Congress changes that, and I mean, what's the likelihood with this many people already serving, already signed up across the country? What is the likelihood of it changing anyway? Maybe tweaked or make it better, but just cold turkey cut it out. That's going to be a lot of people that are hurt.
And I personally, I think it would be a big mistake to just cut it out altogether, because you have so many people who are indigent, people who have no other resources. So I would really not like to see it cut out altogether. I would not.
No, I wouldn't either.
Tweaked, yes, because I think that clause where it says that if you do not have a stable income, this is when you're in most need.
Right.
You're most in need when you do not have any income at all.
Exactly.
So I think that part of it needs to be tweaked.
Okay, well, we're at the end of our time, and I want to thank you, Ms. Bets Williams, for coming in and being a part from Delta Sigma Theta
Sorority
Incorporated. I get it right one day.
And I want to thank you, Ms. Pat, for allowing us to use your program to promote one of our initiatives, which is health and wellness.
No problem, anytime. This is Pat Marsh, your host for the PM Talk Show, thanking you for continuing to join us, and we continue to bring you knowledgeable programs throughout the year that will help you better understand what's happening and whether or not those programs will help you via knowledge. Thank you for joining us. Remember that knowledge is powerful. Knowledge does matter. Have a great week, and God bless.